Okay, we'll go ahead and get started. And I'd like to welcome you this afternoon. Nice, beautiful Friday afternoon. Thank you, Mr. Chairman. And we are going to hear today from the subcommittee hearing on several different committees. We will start out with the Department of Veterans Affairs. Hello, Commissioner Wheeler. I was with the American Legion Post 233 in Loganville yesterday. The Barrett Davis Watson American Legion Post. Commissioner, I think you have a handout, and thank you very much. We appreciate you coming today. And we're going to talk about fiscal year 2015. You can take off.
Thank you, ma'am. That'll be easy to do on Friday afternoon. Good afternoon. I am Commissioner Pete Wheeler of the Georgia Department of Veterans Service, and we are very pleased and happy to be here with you this afternoon. The mission of the Department of Veterans Service is to serve the more than 776,000 veterans in Georgia, their dependents and survivors, in all matters affecting veterans affairs. Assisting veterans to apply for and receive federal VA and state benefits is our department's highest priority. Last year, mostly through the efforts of our employees, Georgia veterans received over $2 billion. That's $2 billion in federal VA compensation and pension benefits. All benefits must be applied for, and we have over 100 employees located in 51 sites statewide, ready to assist veterans to obtain them. Our second priority is to operate and maintain our two state war veterans homes in Augusta and Milledgeville. These facilities provide critical skilled nursing care to Georgia's war veterans. Our third priority is to operate two state veterans memorial cemeteries. These cemeteries, located in Glenville, Georgia, and Milledgeville, are part of the National Cemetery System. They provide perpetual care for the veterans and their families. They are shrines to our state's heroes. There are a couple of issues regarding the fiscal year 2015 budget for our agency, and we want to bring for your consideration here this afternoon. Mr. Dan Holtz, our Assistant Commissioner for Administration, Health, and Memorials, will address them during his presentation. Dan, come up, please.
Thank you, Mr. Holtz.
Thank you, Madam
Are you
Chairman.
going to talk about changes from the House or additions to the House?
Just a couple of things that we want to address.
Okay, what page
but I
are
was
you
gonna,
on?
If I could, I was just going to quickly go through the handout, and when we get to the appropriate programs, I'll identify what we're wanting to
Well, really
address.
what we're interested in is changes.
Okay, well, in that case,
Because we are very familiar with what you do, and I believe Senator Balfour even has a bill for y'all that's pending in the Health Committee about TRICARE, and we're going to take that up on Monday.
okay. Well, in that case, if you'll go to page 10 in the handout.
Okay.
What page 10 is is a proposal that we had made to OPB, which did not get included in the governor's budget, which was to move the federal fund amount of $178,004 into state funding. And the rationale for that is to, excuse me, is to put all of the funding into the state side for budget purposes so that we can do a better job of managing at the cemeteries. And when the federal funds come in, what we will then do is we will offset those against the state funds that were expended for the operation of the cemeteries. So there would be an offset. If you go to page 11, the cemetery program would turn out along the lines of what is depicted there, that it would rise from $498,935 on state up to $732, and then the federal funds would still come in. Part of the problem, Madam Chairman, is we don't know if that 178 figure is a good figure or not. It could be higher, it could be lower. And last year we ran into a problem doing some maintenance work that was done earlier in the year, and then we didn't have quite as many dollars coming in on the federal side as we had anticipated. And so we ended up with an audit note, and if we had all the dollars put into the state funds, we would know exactly how much money we had, and we would be able to operate accordingly. That's one.
So that 178,000
Yeah.
is an ad?
Yes, ma'am. The other thing is on page 12, and I really didn't depict it there on page 12 per se. It has to do with the homes. You'll notice that program at the homes, the governor recommended and the House concurred to consolidate the two state home programs into one. To give us better management capability at the homes, just like we have at the cemeteries, being able to manage them together under one program. But there is an issue which I didn't want to go into a lot of detail on because I know you folks don't deal directly with the capital program. But we did have a conversation earlier this week with Senator Hill about the need for $2.9 million in bond funding to help us get ready to, well, help us convert our home in Milledgeville, particularly the hot water system, that right now we generate our hot water from steam, and the steam is generated by Central State Hospital. As you know, Central State Hospital is going to be closing at some point in time here in the future, and when that happens, the steam plant's going to go away. So we've got to have a different way of generating hot water.
So that new system will be located at that particular nursing home?
Yes, just at the Milledgeville home. But
So-
it's going to affect all four buildings. So,
Yeah.
and that's the reason for the price tag on it.
So you already have the estimates?
Yes, we have an estimate, yes, and that's $2.9 million.
But it'll still go out for an RFP?
Yes, ma'am. It'll be run through the JustFIC project process.
Okay.
And that's really the two issues that, if we're only looking at changes, that's it.
Okay. Are there any questions? I think there is a question at the end. Senator Balfour.
I'm not familiar with you. Are you a veteran?
Yes, sir.
And where did you?
25 years with the United States Air Force.
Well, thank you for your service.
Thank you, sir.
I appreciate it. Are you familiar with TRICARE?
Very much.
Okay, well, I'm just going to ask a couple quick questions to get off this, but it seems to me that when TRICARE is paying less than Medicare, there's a problem with that. Now, I'm not saying it's your problem. I think it's coming from...
Thank you, because it's not my problem.
I understand it's coming from inside a
Right.
perimeter, and it's not 285.
Right.
Do we do any lobbying in Washington to fix the funding that makes TRICARE so unattractive for hospitals to use?
As a state, or
Yeah, that's right.
To my knowledge, no. But I do know that there are a number of veteran service organizations, particularly the Military Officers Association, of which I'm a proud member, is up there all the time arguing that specific issue. And you're right, we are seeing that problem here in the state of Georgia. I've got several friends of mine who are in the medical business. In fact, that was what I did in the Air Force, was healthcare administration. And the physicians in Georgia, and particularly in the Atlanta area, are becoming more and more reticent about accepting TRICARE. And that's becoming a problem. In fact, it's one of the reasons that when I relocated up here 4 years ago from the Milledgeville area, I kept my doctors down there simply because they are accepting TRICARE. And so I have not converted because I've been afraid that trying to find somebody is not going to be an easy task.
Yeah.
And it is an issue. It's definitely a concern.
Yeah. Thank you for your service.
Thank you, sir.
Okay, any other questions? No other questions. Can you leave me a card, please?
A what?
A card, a business card?
I can certainly do that.
Okay, thank you. All right. Commissioner Wheeler, thank you very much for coming today. I know it's a chore now for you to get out, but we sure appreciate you coming. And appreciate your service and all the veterans that you help in the state of Georgia. It's an honor to be able to work with you. Thank you. Okay. Thank you very much. Okay, we're going to hear from the Department of Behavioral Health and Developmental Disabilities. Commissioner Berry, we want to talk about changes. We don't necessarily need an overview unless the senators have a direct question. Thank you very much.
Thank you very much for the opportunity to speak to you today, and distinguished members of the committee, and for being here on a Friday afternoon. I think the momentum for the support for behavioral health and developmental disabilities has never been stronger, and I want to thank you again for your support. And I certainly will get into our changes. There are not many, but if I could just take just a minute to recognize what unfolded last week during the storm for two of our state hospitals out in Augusta. We had staff that worked for 4 shifts in a row. I went out to Augusta and stayed with some of the patients and our staff that were working, and you would have been proud of the service that they delivered to the patients who desperately needed their care. And we also had a private provider out there who lost 8 of their homes with power outages. And the National Guard transported our clients to a hotel in the middle of the night and throughout the next day, and everybody was safe and sound. And so I just wanted to recognize that, and also the incredible work that Melody and Amy have done in supporting our budget process. They have been just absolutely incredible to work with.
Right.
In regards to changes, you have our full budget presentation. We can go through these changes very quickly. The House put in 54.9, a rate increase of $874,000. That's one adjustment that was made several weeks ago. We can certainly discuss that. The other one is 59.3, which is $190,000 for fetal alcohol services. 63.5.
Wait,
I'm sorry?
just a minute. So are you sure that that $190,000 is accurate?
Yes, the $190,000 will be used as match money and can draw down some other funds.
Okay.
And so that will restore the fetal alcohol money that is so needed at Emory.
Okay.
And then 63.5, the hospital contract dollars, a reduction of $500,000.
What is that?
That is a hospital contract dollars. We've had contracts in place to help us through our CRIPA settlement agreement.
Right.
2 weeks ago, we received the letter from the Department of Justice that we have fulfilled the settlement agreement regarding the Civil Rights of the Institutional Persons Act agreement with the Department of Justice, and they are leaving our hospitals.
Great.
And so we were able to take that $500,000 cut, and we're very, very proud of the hospital staff for the work that they did to accomplish that. That was a 5-year agreement, and we met the terms, and they have now left Georgia from the hospital side. And then finally, the only other change that we had was 65.1, and there's 2 pieces to this change. It was an ad for supportive employment of $250,000. That went to the Governor's Council of Developmental Disabilities. We certainly support getting more people with employment opportunities. However, we would request that the change be to adult developmental disability in our department. And I don't think that there would be any questions with that. We'll provide the services. I think that was just a slight oversight. But those were the changes. The rest of the budget is, we can answer certainly any questions and are prepared to go through page by page, but those were the changes.
Okay, on that fetal alcohol syndrome,
Yes, ma'am?
so you're getting a matching Medicaid amount. Should that not be reflected in the budget too?
It can. We can certainly do that. The
Is it-
190,000, Jeff, would bring down,
Is it?
it's a 50-50 match.
50-50 match, okay. So we'll add that in there
Great.
so that we know exactly. Okay, are there any questions for the Commissioner? Commissioner, the only thing I had was that I believe Amy is working on some additional language for your budget.
Yes, ma'am.
So I would just like for you to work with her
Yes, ma'am.
on that changes that she's proposing and let me know your opinion.
Great.
Okay?
Will do. Thank you so much. Thank you, members.
Thank you. Okay, Commissioner Fitzgerald, Department of Public Health. Commissioner, we had a speech the other day on the Senate floor about the SHAPE program. Did you know about it?
I did not.
Yeah, we had a good time. And turned out real well.
Oh, excellent. Excellent,
I
excellent.
think we're really getting the word out about that program.
I think you're absolutely right. And while she's pulling up our numbers, one of the updates we want to give you is there has been a lot of movement on the SHAPE program, and I would encourage everyone to go to georgiashape.org.
Yes.
Because you can see the Power Up for 30, you can see it at a school, the impact it's having. You can see if your school's on it, and we would encourage all the legislators, if your school is not on it, that you encourage them to do it. It's a school-by-school setup, and I think it's an extremely beneficial program.
Okay.
Our budget numbers, okay, next slide. Our budget is very straightforward. You can see this is the page that includes the changes from last year included in the governor's budget. And when it went to the House version, there are 2 additional changes.
Okay.
And those changes recommended by the House are at the bottom. Public health grant, this is the grant and aid monies. It's the hold harmless amount. And
Where
it's
is
one.
that?
It's a.
Okay.
And it is $1.34 million to hold. This is the monies that's sent out for working of the local health departments. And the second change recommended by the House is a transfer of funds from tobacco money that was residing in community health to be transferred to Georgia Core. And this is the oncology research and education amount, and it's $225,000.
Okay. Can you refresh my memory on the hold harmless agreement? Was that originally for 7 years? It's a 7-year phase-in?
Yes, ma'am. The phase-in is a 7-year phase-in.
So we're in our 4th year.
We are now in our 4th year.
So what's the projected cost of the next 3 years?
It's roughly about what we have now. It changes a little bit every year, but it's roughly about 1.3 to 1.5 million
Per year.
Per year. Can I just ask your opinion? Do you think that that phase-in has gone well, or do you think that those counties that have suffered for so long is causing damage? And after that 7-year phase-in, do you think that it's going to be more parity, or do you think that after 7 years that we're going to have to reevaluate it and come back? I mean, what's your ideas on that?
My idea is that, one, I think the phase-in has gone well. And as you well know, because you are well acquainted with your local health department, our health departments have been having budget cuts for several years in a row. After 7 years, we would certainly evaluate. Hopefully, the economy will be better at that time, and we can think at that time of sort of increasing the funding to public health as we go along for the needed services. Because in the historical view of public health, there's been a decrease in amount of money spent to it, certainly for the last 15 years.
Right, right. I couldn't agree with you more. Are there questions for Commissioner Fitzgerald? Commissioner, the only thing, I know it's not really, it is related to the budget, but it's not related to the budget. It's related to legislation also, is to make sure that this summer and fall, when we start looking at rural health, that your department stays engaged with us. Because
we would love to. Kate, if you will go to the telemedicine site, we would be delighted about that. As you know, you just go past. As you know, we now have the telemedicine sites in every single county. In the next slide, and these are the new clinics that have started this past year. Right. And as you can see, Children's Medical Services, Valdosta, Waycross, Dublin, HIV/AIDS, Dalton, Gainesville, Waycross, Columbus, all health departments on breastfeeding nutrition support, and in Albany, high-risk pregnancy support. There is also another high-risk OB that is planned for in the coastal area where it's needed. Okay. Alrighty. So we think we believe that will be very beneficial in making sure that we have the services we need in the rural areas. Okay. All right. Thank you very much. Thank you. Georgia Trauma Care Network.
Thank you, Senator Underman, and appreciate the opportunity to present our budget here. We'll go through just a brief presentation. I'll move quickly. You should have the handouts in front of you. Does everybody have this copy here?
We're just interested in changes.
Okay. We are.
And I know your big change is your revenue stream.
Correct.
Your flow. So where are you with the super speeder?
In super speeder, the House put in an extra $1 million in their budget, and what I wanted to do was comment on that. Mm-hmm. And you know, on the first page there, our funding is from super speeder. Right. If you turn to page 2, that shows you what super speeder has generated from 2011 to 2015. Right. It's running at about $18.6 million. And our budget has been held at 15.3, so we're requesting an enhancement just to be brought up to the revenues of super speeder, which is our only revenue source.
So why would you not ask for that full amount?
I am. We asked when I presented to the House for the full $3 million to bring us up to 18.6, and they put in $1 million. So we are.
You did ask for the full amount.
Yes, ma'am.
So, but you're not asking us, you're just asking to be held harmless?
Pardon?
You're not asking us for the full $3 million, you're happy with the 1 million?
No, we're very happy with the 1 million, but we would continue our plea, since we were tied to super speeder a few years ago as our only funding source, and our budget was drastically cut to match that revenue source. Each year we've come out ahead. In other words, super speeders always produce more money or more revenue than we've been given in the budget. So we would just like to bring that up to speed and be equal. As we were equal in lean years, we'd like to be equal as the super speeder has picked up speed.
What is your answer to the budget of the additional helicopter service in Southwest Georgia?
Well, let me, if you'll flip through the slides to page,
Where that map of Georgia is?
let me just show you what some of the data that we have shows. I've not been privy to any discussions on the helicopter part, but I can show you what I do know, that what we've researched. On page 8, if you look at the trauma centers and the circles around those trauma centers, those are 25-mile buffer areas.
Right.
And each blue dot represents a population of 100 citizens. So you get an idea.
So is it not true that the southeast region, if you look at that, I mean, you don't have to be a rocket scientist, the southeast region was number 1, wasn't it?
Right. You see there's not a lot of coverage there.
Right.
Now, if you flip to the next page and go to page 9, you'll see that the circles are 50-mile circles or buffers. And you can see we're starting to cover more area if you use a 50-mile radius.
Right.
Now, if you go to the next page, you'll see page 10, you'll see that the counties with over half of their territory, more than 50 miles from the nearest designated trauma center, you can very nicely see where those colored gaps are.
Right.
And they are in southeast and southwest Georgia.
So what is the estimated population of that area? I mean, I know you don't know exactly, but is it a large population area?
I'm not sure. I just know those dots represent 100. So if you could add those up, we could get that information for you.
Would that catchment area, is that the catchment area that goes to Jacksonville?
Right. A lot of those citizens are crossing the state line down, especially in that southeastern part, and going to Jacksonville.
So do you have statistics on that?
The commission doesn't have any statistics
No.
on how many go across the line.
So that would be DCH, based on claims at those particular hospitals. Would that not be true?
Probably. I'm not
Yeah.
sure about that.
Yeah. That's what we need. That's what we need to know.
Okay. What I do know about, if you look at those, if you look back, you can see on, if you want to see the regions, you were mentioning the regions on page, we have a page here, page 7. You can see those regions exploded, the EMS regions, and you can see where the trauma centers are.
Yeah. Excuse me, I didn't hear you.
On page 7, if you wanted to see a little more specifically where the trauma centers are and where the regions are,
Right.
that gives you an idea. You
Yeah.
can superpose that on the.
That's why I remembered that region, the southeast region, was number 1, and the southwest region was number 2, and we resolved the issue of that area up there that goes to Erlanger in
Now, I can present you some
Georgia.
additional data there. If you'll flip to page, let me just sort of finish with the clinical data here. If you'll look at page 11, and we've been able to look at, using the Georgia discharge database, hospital discharge database, come up with how many critically injured patients are going to designated trauma centers. And if you look at that graph on page 11, the blue line, you see that in 2009, we had a bump. We went from 64% of patients that were critically
Wow.
injured all the way up to 84% for 2012.
That is great.
And you can see for elderly, for non-elderly as defined by less than age 65, and then in the pediatric population,
That's impressive.
they've gone straight up. And
That is
what happened at that point was your ability to help us as healthcare providers provide funding. You see, from 2003 to 2008, those lines are flat.
Yeah.
That was the healthcare community trying to do it on their own, but when you all provided funding, we made dramatic improvements.
That's impressive.
Now, to answer your question, Senator Unterman, about the regions, if you turn to page 12, you can see in blue the patients that were going to a designated trauma center that were critically injured. Now you can very nicely look at each region and see where we need to commit resources. So in Region 8, where you were talking about down in South Georgia,
Yeah.
you see only 40% are going to a designated trauma center.
Yep.
In Region 10, 44%, and in Region 2, 41%. So this has allowed the Office of EMS and Trauma, as they go out and recruit trauma centers along with the commission, for us to really concentrate our resources. And in Region 2, we've had a trauma center come online, a Level 2 in the last year, and in Region 10 as well. So we expect to see those numbers go up. So this is the kind of map that we're trying to put together to help guide us, as to where we need resources so that we can approach you about, educated decisions on funding. And then if you look at the last two slides that I have, number 13, this is one that we're most excited about. You see, this data is from January. Just last month, we were able to put this data together. And if you look on the y-axis, you see the probability of survival. And then across the bottom, the x-axis is really the injury severity. And I don't want to bore you with all those details. But basically, the blue line is patients that were critically injured that were taken to designated trauma centers. The red line is non-trauma centers, and you can see for all those different levels of injury, designated trauma centers patients have an increased chance of survival. If you want a number to remember down in the bottom part of the page, for all patients, the survival advantage of going to a designated trauma center for critically injured patients in Georgia, this is not national data, but Georgia data, is 9%. And if you look at traumatic brain injury, that jumps to 14%. And then the last page, on page 14, what about going home? Probability of normal discharge. Again, you can see for every level there, patients that go to a designated trauma center have an increased chance of going home. In other words, not having to go to a nursing home or other facility. And what that means is a lot of our patients are Medicaid, and that means that if they can go home, there's obviously decreased funding that we need on that side. So we feel like we're moving in the right direction. We're getting more sophisticated with our analysis, and that's why we, would respectfully request, the additional funding. We've been able to do that with the amount that we've had, but there's only a certain limit as to what we can achieve.
So the question is, if these 2 additional helicopters are provided in Southeast Georgia, how do you incorporate them if they're not a line item in the Trauma Commission's budget? How do you have the ability to interface with them on diversion issues through Forsyth?
Well, right now, again, we've not been involved with that, setting up that line item, so I don't really have a lot of comments on how that would work. We're certainly happy about any agency or any office looking into trauma care in South Georgia and wanting to help. And we think the more hands on deck, the better. So we certainly appreciate folks looking into a need.
So do you reach out to them, or do they come to you?
Well, we stand ready if anybody approaches us and wants our data, if they want help, if they want us to look at something, we'd be happy to.
With the actual mobilization of the Forsyth Communications Center, do you reach out to them, or do they reach out to you?
Well, I guess we would reach out now in the sense that we haven't been contacted by anyone, and we don't really know how the system would work or how the plans are being developed in South Georgia. But we certainly stand ready. If anyone approached us, we'd be willing to help in any way we could.
Okay, that answers my question. Is there any questions? Thank you very much.
Thank you.
Okay, Department of Children and Families. Office of Children and Families. Did I skip one? Yeah, that's a good question. We're looking out for you.
Always.
Thank you very much.
Good afternoon, Chairman.
Good afternoon.
Committee members, thank you for allowing me to be here. I'm Katie Jo Ballard. I'm the Executive Director of the Governor's Office for Children and Families. And our budget's located on page 13.
Are you talking about the regular budget, the line item budget?
The one that Amy sent out? Yes, ma'am, the
Okay.
line item budget.
Okay. There we go. Okay.
And I'll start off with telling the committee that the Governor's Office for Children and Families underwent zero-based budgeting analysis over the summer, and that's where the governor came up with the bulk of the recommendations here. He is recommending transfers based on that zero-based budgeting analysis to align state and federal resources. So I'll start with line item 165.3, which is the transfer of 5 positions to the Criminal Justice Coordinating Council, along with the administrative dollars for family violence and sexual assault. Criminal Justice Coordinating Council is the second largest funder of domestic violence shelters and sexual assault centers. So this is just aligning the state and federal resources.
Okay.
Line item 165.4 is the transfer of 4 positions and the federal dollars for juvenile justice to the Criminal Justice Coordinating Council.
What number is that?
165.4.
Okay.
And this is to align the state dollars that Criminal Justice Coordinating Council started administering last year for juvenile justice. 165.5 is the transfer of 6 positions and the federal and state resources for child abuse and neglect prevention and family support to the Department of Human Services. And 165.6 is the transfer of a position and the dollars to support the initiatives around commercial sexual exploitation of children to the Criminal Justice Coordinating Council.
So, can I ask you a question about that? What influence will you have over that after it's transferred?
The Governor's Office will maintain the CSEC task force, as well as the nonprofit Georgia Cares will still be under our direction. However, Criminal Justice Coordinating Council will be administering the dollars related to that.
And the contracts?
Yes, ma'am.
Okay. All righty.
And then 165.7 is the transfer of $1.175 million in support of the Children's Advocacy Centers to the Department of Human Services.
Okay.
Are there any questions?
Yeah. Is there any questions? That's it. Thank you.
Thank you.
I appreciate you this fall keeping me track of all these moves and everything. I think that's why there's not so many questions today. You've done a good job keeping us up to date, and we appreciate it. Thank you. Let's see, Office of the Child Advocate.
Good afternoon.
Good afternoon.
Chairman, committee members, I want to thank you for this opportunity. As you probably well know, I've been newly appointed as of February 1st, so while I'm very familiar with child welfare and very honored and excited to have this position, this part of the process is new to me. So what I'd like to do, I am here to support the governor's recommendations to the budget. I looked at the line items that were sent by Amy to my office, and what I would ask to do with permission is go through each of those items, my understanding of them, and then ask for any questions. I also want to thank you individually and Madam Chairman for your personal support and all you do for the children in Georgia. I'm very familiar with a lot of legislation and things that you all are doing, and we're very appreciative of that. The first is on page 12 of 52, and you will see it's 164.1. Both that and 164.2 reflect the increase in funds that have been provided for state agencies for both retirement and merit-based adjustments. On page 13 of 52, I would move to 164.3. This reflects the transfer of monies from the OCA to DHS for Department of Human Services for the CFR, the Child Fatality Review activities. Specifically, it transfers database administration to align the CFR work with DHS. Right now, we have DHS employees with child fatality review. This just removes the responsibility to one place, although CFR is certainly still within OCA at this moment. Line item 164.
Can I ask you a question about that?
Yes, ma'am.
So how does that relate to the, I think it goes to the next one. How does that relate to the relationship with the GBI?
At this time, I know the legislation is pending that I believe this particular item, as well as the individuals, would be transferred to the GBI, but this would provide for it all to be uniform prior to its transferring to GBI.
That's what I want to make sure.
Yes, so that aligns it so it will be in one spot in order for it to easily transfer, is my understanding.
Okay,
And I'd welcome further questions on that if I can do more information for you on that.
okay.
Line item 164.4 is the increase of funds for personnel and operations. Specifically, this is because of anticipated increased salary projections and projected expenses to cover and replace things like outdated computers, outdated equipment, outdated software. We need to maintain and utilize data, which is critical to meet the mission and requirements of the OCA and improve and make more sophisticated our reporting and ability to use that data to help guard the welfare of the children.
So this money would also transfer?
No, ma'am, this would not. This is specifically for OCA. This is not for child fatality review. This is for OCA child welfare.
Okay.
Whereas the 164.3 is specifically for the child fatality review, which is also currently within the OCA.
So this stays?
Yes, ma'am.
So
The
say
160
again what it's for?
The 164.4 is for the staff personnel projected salary increases, as well as increases in projected expenses. And again, that's the outdated computers, technology, software programs, databases.
So when you say staff increases, what is that?
Just increased salary projections for those who are there and will be needed to run the OCA offices.
Are these existing employees?
No, ma'am. I don't know for sure. Part of what I'm working on is figuring that out, to be honest, but it would be for the current employees, but also to hire a deputy director to replace one that's no longer there, as well as one other staff position. I'm sorry, I should have clarified that from the beginning. That was my error.
If you could give that to Amy.
Yes, ma'am.
And tell me exactly how many employees you have, how many positions are vacant, and what the changes are, and if you'll give that to Amy, that'll help out.
Yes, ma'am. Be happy to. And then line items 164.5 and 164.6, both of these involve the transfer of funds. The 164.5 is specifically the transfer of funds to the Department of Human Services for forensic interview training, and this would assist to pay for training. And 164.6 is transferring money to the CJCC for GAL training. And these agencies collaborate with OCA, and we're doing that proactively. So we'll still be involved in the training and doing those things, but it's a transfer of monies for them to provide some of those trainings.
So how many people are you training?
Chairman, I'll be honest, I don't have an answer for that at this moment. Again, I'm happy to gather that information for you.
Okay,
I know that they've been doing training in 2013, but I don't know that number off the top of my head. And I apologize that I just have to gather some of that.
I understand that you're new, but if you could tell me, I'd like to see the program that they're using, and I'd like to know how many people are being trained, and I'd like to know how many hours of training. If you have that, that'd be great.
I'd be happy to. And those are all the line items. Was there any other requests for additional information that I'd be happy to provide immediately?
Amy, do you have any? Let me just double check. You know what? I asked the questions that they asked. I must have read their mind. Thank you very much.
All right, thank you. Appreciate your time today.
Thanks for coming, and we're glad to have you on board.
Thank you. I'm happy to be here.
Okay, voc rehab.
Good afternoon,
Hello,
Madam Chair.
Hello, I've called
How
you
are you,
Commissioner.
Senator?
Director, I'm sorry. Glad to have you this afternoon.
Good, good. Thank you for the opportunity to present on the 15 budget. I've just got a 3-page handout, and I'll just get right into it if that's okay with the committee. If you turn to the second page, really what we've done is walk through each of the programs, and you'll see in red there is the corresponding tracking number, and I'll certainly answer any questions as we go through this. But the first program there is the BEP Business Enterprise Program under our agency, number 195.1. The change is the addition of the $4,573, which is part of the increase in employer share of ERS. Line item 195.2, an increase of $1,686, which is really for targeted merit-based pay adjustments. And if I could just do a sidebar, just to comment on that, and I won't comment as it comes up in other programs, is that we really do appreciate the Senate considering a pay increase for state employees. The staff in our agency haven't had raises in 6 years, and so we really do appreciate the consideration by the Senate. The next program is the agency administration, item number 196.1, which is the $82,000, again, to go for the increase in the employer share of ERS. And then item number 196.2, the $28,000, again, for targeted merit-based pay adjustments. The disability adjudication services, our DAS, the only changes there's no changes in money because they receive no state funds, is a correction in the name of the program. It really should read Disability Adjudication Services. And then the change, with clarification in the change of the program purpose, and that's the program that adjudicates Social Security, supplemental income, and disability income claims. Going on to the fourth program, Georgia Industries for the Blind, they receive no state or federal money, so there's no changes there. And then we get down to probably the most complicated ones, the Warm Springs Institute and the VR program. The first item is 199.1, and that is an addition of $469,000 to support an increase in hospital-based expenses. And let me follow that, though, shortly with 199.2, which is really, this is where they're recommending, which we support fully, is taking the vocational services of Warm Springs and moving them under the VR program, making it a sub-program as Georgia Regents University takes over the hospitals to stand alone. So what 199.2 is actually moving the $3.5 million out of the Warm Springs vocational appropriation, and you'll see it's reflected and transferred down to the VR program in item number 200.4. And then again, the change in the name, 199.98, would be the Roosevelt Warm Springs Medical Hospitals, and the purpose obviously would change to 199.99 to just provide medical rehabilitation. And then the fifth program, the VR program, as you see there would be 3 sub-programs: the Vocational Rehabilitation Field Services, Cave Spring is what the CS stands for, the vocational services at Cave Spring, and then the Roosevelt Warm Springs Vocational Services. And the changes proposed for that program are line 200.1, the $552,000. Again, that's an increase in the employer share of ERS. Line 200.2, the additional $10,000 for the additional cost of teamwork billings. And then line 200.3, $220,000 for the merit-based pay adjustments. And then finally, line 200.4, that's the transfer of the $3.5 million down from the medical side of Warm Springs to the vocational side. The advantage of making it a sub-program is that it allows us actually greater flexibility to focus clearly on vocational services as well as to maximize the federal grant opportunity, the vocational grant.
Okay.
The last page, just for your information, is the same programs, but it shows all the sources of funds. The state funds for 14, the proposed changes, the federal funds. Other funds, for example, would be in GIB, those are what they earn on contracts. In the hospitals, it's what they would bill either through commercial insurance, Medicare, Medicaid, et cetera, and then the total budget. I'd be happy to answer any questions you all may have.
Is there any questions for the director? When you make this transfer of those funds to VR,
Yes,
are
ma'am.
you going to be able to draw down more federal dollars?
We actually think so.
How much more? You knew if you said yes, I was going to ask you how much more.
Well, part of it is, for example, all of the costs that are administrative support on Warm Springs is an example. We have to allocate some of those to the medical side and some of those to vocational. We can only match those that are allocated to
Right.
the vocational side. Once the hospitals are spun off, 100% of those administrative costs will be matchable. So we're going to pick up 80 cents on every dollar that we transfer.
So what's the estimate?
I don't have an actual estimate. I'll be happy to actually come back to you with the actual number. I
If
don't
you will
wanna-
give that to Amy,
I certainly will, Senator.
that'd be great. If you could do that over the weekend and give it to her, that would be great.
I will
'Cause
do that
we would
for you.
like to know.
Any other questions y'all may have that I can answer for you?
I think that's it. Thank you very much.
Thank
We
you, Senator.
appreciate it.
Appreciate it.
All right, next and last, we have DHS. Commissioner Horton. Thank you.
Good afternoon, Madam Chair.
Thank you.
And committee members. You have a handout, and I'll call out the tracking numbers as we go through. You don't want to put it up? Is it what? Madam Chair, is it okay if we put the presentation on overhead?
On the what?
Overhead.
Oh, yeah, sure.
As he's preparing that, I'm going to go ahead and just start off by saying that as we go through this presentation, you're going to see statewide adjustments. I think everybody has mentioned those statewide adjustments. We have about $6.3 million in statewide adjustments. That includes the employee retirement, the merit-based pay, as well as PeopleSoft billings. So I won't cover that as we go through the programs. Also, as we go through the programs, you'll see workload adjustments and other adjustments. There's one thing that I do want to bring to your attention, and that is we have a federal MAP, Federal Medical Assistance Percentage Adjustment, which is FMAP, which increases the federal dollars, and you'll see a decrease in state dollars to offset that. So these are not cuts as we go through the presentation. They're simply offsets. So for the first program, I'm on page number 3, the adoption services, which is section 173.1 on your tracking sheet. You'll see a statewide adjustment of other adjustment of $176,000. Again, this is the federal increase in the FMAP, and so
Wait
we have a
just a minute.
statewide adjustment on state funds.
Wait, just 2 seconds.
Okay,
What, you said 170?
it's
3?
173.1
Okay,
on adoption services.
okay.
Okay, so I'm just covering the changes that we have for the FY15.
Right.
Okay. Okay, the next slide is the 175.1, which is your child care licensing. This resides in the Office of Residential Child Care, and they do inspection, monitoring, and enforcement. Again, statewide adjustments. No changes here. Child support services, 177.1. You see statewide adjustments as well as workload adjustments. And I think I've given the story, but I'll just try to just give a quick summary. Child support earns incentive dollars based on their performance. Over the last few years, they've earned a significant amount. During the RR period, you could match incentive dollars with other federal dollars, almost 2 to 1. There was a strategy between DHS and OPB to maximize the matching ability. And as a result, they reduced the state dollars. And over those 3-year period, child support was able to build up a small reserve. They've completely exhausted that reserve at the end of this fiscal year. And so the $3.3 million will go a long way in restoring child support at its operational level before the R period. This affects 88 caseworkers if we don't get the money for child support. And as you know, this is 235 employees. This program is all about parent accountability. Any questions about child support?
Mm-mm.
Okay. All right, I have a slide. If you're looking at your handout that we have a slide, and I'm not going to talk about the accountability. That you can look at that at your leisure. But we have some things, some initiatives that Child Support is working on, and so I'm not going to highlight those things at this particular time. I'm going to the next program, which is 178.1, which is Child Welfare Services. There are several adjustments. You see the statewide adjustments. There is also a $8.7 million adjustment, and that has to do with the fee-for-service Medicaid. A portion of our caseworkers' time is billable to Medicaid under the target case management, specifically the time when caseworkers are discussing medical or behavioral health issues with the children in DFACS care. Once we transition to a managed care program, we will no longer be able to bill for those particular services. AmeriGroup will be the case manager, and the Centers for Medicaid and Medicare only allow one case manager. This will result in a loss of $8.7 million in targeted case management, and we use that money to offset our caseworkers' costs. So this is the equivalent of 170 caseworkers, this $8.7 million. The next adjustment is $7.3 million. We're very grateful and gracious for the governor to give the $7.3 million for the first year. This is for the 3-year plan for 175 caseworkers per year.
So could you tell us, that's a 3-year plan. What is the first year, how many workers?
175.
Oh, so they're all hired?
No, they will be hired we'll start the process early on so that we can start bringing on people 1 July.
So will you be completed in the fiscal year?
With the 175, yes.
You will be?
With the 175. We'll bring on 175 within fiscal year 15. But it's 500 over 3 years. So each
500 over 3 years?
525 over a 3-year period.
Okay, that's what I got. Wait a minute. And all of these are hired at the base salary?
They are.
Of what?
Roughly $29,000.
$29,000.
Yeah.
What's the turnover rate?
It averages anywhere from between 21 and 24%.
21 and 24%?
Yeah, anywhere from 21 to 24%.
Is that the national average?
I don't know the national average.
Is that the same average that it's been maintained?
Yes, it has.
During the recession even?
I'm not going to speculate on that. I'm going to Dr. Hill, is Dr. Hill? Go ahead. The national standard, did it go down during the recession? And I would speculate that it went down during the recession.
You know, slightly, but again, I think across the nation we do see in child welfare from about an 18% to 25% turnover rate.
A what percent?
From 18 to 25.
So you're on the high end?
Yes, we are, right, in Georgia, yes.
Okay, thank you. Okay, let's go back to,
Just grab a seat up here.
let's go back to the beginning of child welfare services.
Okay. On the 8.7 million? So
No, to the investigate allegations of child abuse abandonment. What is Title 4B funds?
10.
What is the difference between Title 4E and Title 4B?
4E is foster care.
4B is a block grant that the feds give us. There's 4B Part 1, which is a very flexible block grant, but it's relatively small, around $9 million a year.
Uh-huh.
Then Title 4B Part 2, which is commonly called PSSF grant. You may have heard of those.
Right.
Safe and Stable Families, which go out to the local agencies. They have to match 20%.
Right.
4E is the much bigger funds.
Right.
Foster care, case management, and placement.
Could you just give me a spreadsheet on that and give it to Amy?
Sure.
So that I'll have that when we go to conference committee in Green Door, and I have to give my presentation. And I wanted to know on the Kenny A consent decree, for Fulton and DeKalb counties, what is the caseload in those counties versus the counties, the rest of the state that is not under?
We have a slide in your packet.
And it shows that?
Right. It gives you a graphical depiction of the caseload for Kenny A versus in Fulton and DeKalb
Right.
versus the remainder of the state.
Okay.
And that's in your packet.
Okay, thank you.
Okay. So if you want to go to that's slide 8. We have it up now.
Slide 8, page 8?
Page 8.
Okay. Yeah, that's what I wanted.
Okay. So the purple, if you look at the purple line, it represents the Kenny A counties, which are Fulton and DeKalb. You can see the caseloads there. The blue represents the combined caseload with Kenny A and the remainder of the state. You see that one?
Yes.
And then the red represents the 157 counties, minus Fulton and DeKalb. And then the black represents the difference. So you can see Kenny A is right around 12, 13 cases.
Mm-hmm.
That is what is mandated.
Okay, so this goes back to what we were talking about yesterday of the juvenile justice reform and the RYDCs and the YDCs, and anticipating that you're going to have less people going into the RYDCs, into that system.
Right.
So, do you anticipate this caseload going down?
Especially, yes, especially with the number of case workers that the governor has put in funding for.
Mm-hmm.
With 525, we should be able to move that number down from a high of 20 down to 15, which is manageable. Anywhere from 12 to 15 is a manageable number. I'm talking about for the remainder of the state.
Right. But you're
Yeah,
still
over 3 years.
seeing these numbers going up. So would that flatten off?
Yes, I definitely think so. When you bring on more caseworkers, you release some of the stress that the other caseworkers have. You reduce the amount of cases that an individual has to carry. So we're looking at bringing on 525 over a 3-year period, 175 the first year. So you should see some significant decreases in the caseload size.
Okay.
Madam Chair, do you want me to go back to the, do you want to go back and revisit the 178.1? We were talking about we just finished talking about the TCM, the targeted case management, the 8.7 million. Okay.
Yes, that'd be fine.
Okay, so we we talked about the 8.7 that has to do with targeted case management. It has everything to do with outsourcing of the medical and behavioral health to a Mary group.
Right. We got that one.
And then we talked about the $7.3 million. That is for the 175 caseworkers.
Right.
And then the $911,000 is for the 16 additional caseworkers for the Child Protective Services intake system, 24/7 intake system.
Let's talk about 178.7. That's an add by the House.
The what now?
178.7.
Oh, the clothing allowance.
Mm-hmm. So what's the current clothing allowance?
$309 for initial.
What is it?
$309 initially,
Mm-hmm.
and then it is 206
Annual?
up to age 12 annually, and then for age 13 and over, 309. And so
309?
right. So at initial intake, 309. Up to age 12, 206. Age 13 and over, 309.
Now, do they get an allowance for like back to school to have like a book bag or anything like that? Is that included in the clothing allowance, or
No,
is there not an allowance for school supplies?
no.
Okay.
So this $100 will go a long way in ensuring that parents who are foster parents will have funding to purchase those items that kids need, especially when they outgrow, or especially if you have a young man who may outgrow a size 10 shoe.
So when they go from, if they're in one foster care family and they go to another foster care family, the money follows the child?
Right.
And that family will know when they receive that child how much money they have left?
Yes, yes.
Yes.
Yeah. So what if they, when they're going from one family to another, they leave their clothes? Is there an emergency? There used to be an emergency allowance. Do you still have that?
I'm not sure if it will be an emergency, like most of the counties do have, right, their own funds, or many times some of the local offices raise money within the community for those additional things, like more clothing, school supplies,
Right.
backpacks and all of that.
But that's up to the individual county.
Right, the counties are generally generating those funds, yes.
Yeah.
And I would say that most counties are very generous about that, because I've visited several counties and they have a storage area where they keep
Right. Yeah, I've seen 'em.
emergency items for food, emergency items to include school supplies. I've seen them in Clayton County. I've seen them in a couple other counties that I've visited where they have those areas.
Yeah.
But it's no mandate to have that. This
Right,
is out
right.
of generosity of
Right.
the staff there.
What about the grandparents raising grandchildren? Do they still receive that allowance?
Yes, they're still receiving a CRISP allowance, and they receive it's a small allowance, about $50, but the CRISP allowance allows them to, based on the number of children, to get a one-time amount, a significant one-time amount, especially if they're on TANF, about $235 per child. And then also, with grandparents raising grandchildren, you have not only the DFACS contribution, but you also have the child support contribution
Right.
of redirecting payments. And then you have Division of Aging Services that are providing those resources to
Right.
those parents.
Right. Yeah, I started that. I know all about it.
Yes, yes, it is. And
It's a great program.
It is absolutely a wonderful program. As a matter of fact, we met this past Thursday to re-energize or rejuvenate the program to make sure that we're getting more seniors. We have more grandparents who are raising their grandchildren, and we want to see more grandparents having the necessary resources to take care of the families.
Right. Great. Okay.
All right. All right. So we are on. So you have a slide in your packet, actually page number 9 in your packet. Really talks about some of the things that Dr. Hill and her team, as well as DHS, is doing on the child safety piece. I'm not going to cover that, but that's for your. If you want to peruse through that, you certainly can. I do want to highlight something that I think is very important, and it has to do with the previous administration, Commissioner Clyde Reese and Director Ron Scroggie. They developed the child death report. I think that's important, the child death report.
Child what board?
Death report.
Oh.
The
Okay.
child death report. That report is available online. Anybody can pull that report. But what it does is gives you an idea of the child deaths or fatalities that have happened that DFACS has touched. It does not encompass all of the child deaths in the state, only the ones that DFACS has touched. And one of the things that is interesting about that report is the fact that there's a category and it has co-sleeping in it. And each quarter we have individuals who die from co-sleeping. Okay. All right. I'm going to move on to the Child Welfare Services Special Project, which is 179.1 in your tracking sheet. And this is, I think Ms. Katie Jo Ballard covered this one already. But this is transfer of 6 positions from the Governor's Office of Children and Families, and this is to continue administering the Child Abuse and Neglect Prevention Program. And again, this is a result of the zero-based budgeting analysis required by the legislature. All right, I'm going to move on to 181.1, the Department of Administration. And this $2 million is simply to replace one-time funding that was lost so that we can pay our GITS bill. The $44,000 has to do with the transfer of one position from to the Child Fatality Review Board. We don't know exactly where that person is going to go or where it's going to reside, but we are willing to transfer the money as soon as that determination is made. All right, 182.1, which is the elder abuse investigations and prevention. Now this one, Madam Chair, is very similar to the Child Protective Services. This is a 3-year plan for 32 APS workers, the Adult Protective Service workers. Say again? This is 182.1. The $693,000? 182.4. 182.4. Right. This has to do with the APS workers, additional workers. This is, again, a 3-year plan, very similar to the Child Protective Services plan. But in 3 years, it's how many people? 32 total. 32 total. Yes. And then there's another adjustment. This is a huge start. This is 228,000, 226,000. I want to say it's almost the same as child welfare, but I'm going to let Dr. Bulat speak to that. Yeah. Yes, they're about the same. You have the $226,000 there. This is a huge start for the state as we have more awareness around neglect and abuse. And this is this funding provides temporary shelter for at-risk adults. 182.3. Yeah, 182.3. It's the $226,000 for respite. So, are you comfortable with that? I think it's a I think it's a huge start. So, based on your calculations of what was in the 14 budget, is that how you came up with this number? I don't think this number was what was originally asked for, but it's half of what was asked. It's 1/2? Yes. Do you feel comfortable with that? I think it gives us a start to at least identify respite areas across the state. It gives Dr. Bulat an opportunity to contract to see what our gaps are. If you had a large facility that closed overnight, does that mean that you would have emergency funds somewhere else and you would just ask for it in the amended next year? I mean, I think one of the things that we have to do is the money that we have, he's going to look at it, doing a contract across the state to see if we can have respite beds, if you will, for those individuals who are in a dangerous environment to move them to another location. I think there needs to be an evaluation done, and based on that evaluation, if there probably will be gaps, but if there are gaps, then there may be a request to come back for additional funding. But first, we need to roll out a plan, and so this gives an opportunity to get a plan in place. This is for when you have a person who is. Well, he's going to look at it is contracts for beds, but he's going to look at how he's going to roll that out. He's going to have to contract with some provider in order to do that. So will it be one provider to cover the whole state? He hasn't gone through that process yet, so we haven't gone through that process. Once we go through that process. He's working on a plan of action, but it's got to be a procurement. It's going to be a procurement process that we have to go through. Okay. All right. In the next couple of slides, you have those who are following the slides. You'll see the APS caseloads. And I'm not going to cover those. Those are kind of self-explanatory. You can see that the investigations have gone up while the actual number of investigators has remained the same. All right, Madam Chair, I'm on number section 183.1, and I'm at the 183.3, the $1.2 million. Again, this is a result of the FMAP, zero-sum gain. There's no cut to the division, increase in federal dollars, and a reduction in state dollars. 184.1 is just statewide adjustment changes, as well as the House added $750,000 for meals. There was no original ask on meals. I'm gonna have to ask Dr. Ballot on the waiting list.
We have about 11,000 people on the wait list for approximately 20,000 different services.
Can you give us that sheet that shows the waiting list for the different services? Can you do that on Monday? Yeah.
What is it?
Yeah. So the $750,000 will increase services for how many on that waiting list?
About 350 individuals
350 across the state?
across the state, yeah.
Obviously, the metro area has more requests. Is this targeted for a certain area of the state, or is it?
Generally speaking, we base it on level of need, so individuals who have a higher level of need rise up on the wait list.
Okay.
And we try to make sure it's evenly distributed and using the population density across the state.
So if you're getting, so can you come forward?
Yeah, come on up.
So if you're getting $750,000 for Meals on Wheels, what about community-based services like in-home services for nursing care?
That,
That's not getting any additional money.
no, that wouldn't affect the in-home services outside of the Meals on Wheels that's delivered in-home. Now, depending on what happens with sequestration, if we're given any funds back, there's a possibility of shifting some resources to enhance the in-home services, but we still haven't gotten our notice of award yet on what our sequestration impact or help would be.
So I know you're gonna send me this, but how many people are on the wait list for in-home services?
That 11,000 is almost everybody who was on a wait list for in-home services.
So when you prioritize based on the next step is a nursing home.
Everybody on the wait list currently meets the level of care for a nursing home right now. So they can go into a nursing home tomorrow if they,
The average cost of a Medicare, Medicaid nursing home is how much per year?
the state and federal match is about 36,000 a year.
36.
Yeah. And then there's the piece that comes from the client, from their Social Security or whatever resources they have.
All right. All right, we're going to move on to section 187.1, which is the Federal Eligibility Benefit Program. And this is the eligibility for child care, Medicaid, TANF, and food stamps. You see the statewide adjustments, and then there's 162,000. This is for DFACS needs additional staff. Need additional staff. The 162,000 along with the 50,000. I'm at 187, Madam Chair, 187.4. Okay. The 162,000 along with the 50% federal match allows for the development of a dedicated Medicaid unit. Even though we're moving to the managed care approach, there's some specific tasks that unit's going to have to do, such as moving children into Medicaid case within 24 to 48 hours, and then removing children from active or pending county-based benefits. Any questions about that? In your slide packets, there are a couple of slides that look at the, that really give you a graphical depiction of how the increased demand has really hit the department over the last several years. And then the last one is out-of-home care. That's section 189.1. And that was a reduction of 527. Again, that was the FMAP, increased federal dollars. So it was a zero-sum game in that one. So there's no cut to the division on that one, but, and those are all the changes that we have. Yes. Right. We track those individuals who receive Medicaid and TANF. We track those individuals. We know who applies for Medicaid and who applies for TANF through the refugee assistance. I can't speak to that right now. I can check and see if that's been done over the years. It resides in the department. No, it's a separate program. We're doing contracts, but we are tracking individuals, and we have to do the statement of needs for the contractors. We actually have to go and check on the individuals. We have about 5 to 6 people who are working that program. That's their sole responsibility is to make sure that we are administering, that the federal dollars are being administered correctly, and that the people are receiving services. Right. Right. I can do it. I do. I'll give you all the demographics on the program. Thank you.